Hello, nursing faculty. It's Tia Maruko, the coordinator for instructional technology and design, here to have a pep talk about structuring a learning experience in a socially distanced classroom. While we will be face to face on campus this upcoming semester, students and faculty will have to follow strict social distancing guidelines that will include, at the very minimum, masks and staying at least 6 feet apart when possible. Restricted movement around the classroom to encourage touching as few surfaces as possible is also good practice. All these guidelines to facilitate safety on campus means that the classroom will look different than in the past. Here are a couple ways that the classroom environment may look and feel different. Students and faculty will be wearing masks. If you rely heavily on nonverbal expression from students to facilitate your teaching, you will have to provide alternative outlets to collect that same information. Nodding is still a way that you can request nonverbal feedback, but you will not be able to see smiles or frowns. Something to be aware of, since our traditional ideas of connection typically include both verbal and nonverbal communication. You will be socially distanced when possible. In combination with students and faculty wearing masks, any speaking requires amplification so that everyone will be able to hear effectively. Microphones will be provided by the college, but they cannot be shared. The instructor will need a microphone, and you will need to make arrangements with IT if you would like to have a standing microphone available to students. Physically breaking out into small groups will be difficult. Even in our biggest lecture room, given the average size of the nursing cohort, there's not enough space. Also, it is very difficult, if not impossible, to have multiple groups speaking to each other at a social distance without creating distracting levels of background noise. Walking around and checking in on individual students in lectures will also be difficult. This is the nursing education program. So for the lab, simulation, and clinical learning environments where groups will be smaller and safety protocols are baked into the content and learning exercises, you may find that masks and social distancing feel more quote unquote natural in this learning environment. So if we take out the physical part of the equation, we're still left with a very powerful resource, which is time, specifically real time. The ability to meet in real time when everyone is together and focused on the course is a resource that for most of 2020 we learned was incredibly valuable. So let's think about the main thing real-time interactions afford us: immediacy. In the classroom, you can immediately diagnose pain points or muddy areas in a student's understanding and provide immediate feedback. You know this feeling when you're lecturing and you stop when someone asks you to clarify what you said, or when you clarify a student's understanding of a concept? That immediacy of clarification or correction is still there. In fact, you can have this across any synchronous meeting space, including through technology mediated communication, because the learning environment does not have to be restricted to the classroom. Active learning and engagement should not be restricted to the classroom in a content heavy course. Being responsive to your students' needs and engaging students is ultimately the biggest part of connection. And you can still solicit, maintain, and more importantly, measure engagement across all these spaces, including within the classroom, using similar tools that you would in an online space. The following series of videos and resources offer just a few ways to use technology-mediated communication to maximize your time in a socially distanced classroom. If you have any questions at all, please reach out to moodlehelp@berkshirecc.edu.